they are saving the life of a patient by donating it. But what is important is in these donations, the voluntary donors are important. Others are paid donors, and paid donors, there are chances of infection. 14th June is the anniversary of the birth of Karl Landsteiner, the blood group AB who discovered, awarded Nobel Prize. Donor blood may not detect HIV, hepatitis B, hepatitis C and syphilis if infection is very recent. That is the real problem. And in case of HIV, they call it as window period. So during that period, the detection HIV will be not there. So that is why the correct and proper history is very important while of donor. So donor should give a proper history, and he should not hide anything from those doctors. The globally, up to 4 million people have been infected with HIV. So that means 40 lakhs people have been infected with HIV because of the transfusion of unsafe blood. So this is not a purposely unsafe. It is detected, everything, because one important thing is, as soon as the blood donor donates the blood, the first thing is, whatever the number of days required, nowadays 3 days or require 3 or 4 days for getting all reports. The reports will be about hepatitis B. See, hepatitis B, if it is a carrier or if the patient, the recipient gets infected with hepatitis B, there is a chances that he may get liver cancer. In China, the maximum number of people are having hepatitis B. Even hepatitis C, the chances of liver cancer. Hepatitis A, there is nobody worries about it to that great extent, which we generally called as a jaundice due to the infection and not through the transfusion of any saline or the blood, unsafe transfusion. So the blood donation, the rules are there. Donors age 17 to 65, medical history, pulse, blood pressure, hemoglobin should be greater than 11. So it should be greater than 11 grams per dl. Blood should not be released. Blood should not be released for the recipient until the reports of negative for hepatitis B virus, hepatitis C virus, HIV, syphilis, and also they do the malaria testing. Because malaria is also transmitted. Who should not donate? That is important. The feeling unwell, anemic, pregnant, or breastfeeding. That is the reason why the number of women are comparatively less. High blood pressure, heart disease, epilepsy, or on antibiotics. Suppose if the donor is taking antibiotics, you should reveal it to while donating the blood. Because what happens, donor means somebody is sick, we call somebody, are you going to donate it? Yes, he rushes. He said, yes, everything is fine, because he is under tension. Ideally, under tension also one should not donate if he is direct relation, because that psychological trauma will be also be harmful for the patient. So, but, yes.
And the weight also.
Weight also. 115 pounds they have given. 115 pounds. So you can convert it into kilos. Then this is the two slides. The last two slides are for the future. So what is the future? The past, we've seen the present, and now future. The future is, this is in the year 2007, the future is umbilical cord blood. Banking has become a new optical trend. It offers expectant parents a biological insurance policy. Now let us understand about what is the biological insurance policy. So after the birth, what future I can see tomorrow, after every birth, the umbilical blood will be collected, the stem cells will be separated and kept it in the liquid nitrogen for the years. And then suppose if that particular child requires for a heart disease at the age of 40 or 50, the heart attack, and to make the heart function properly. Again, the stem cell transplantations, we heard a lot of things. So that could be done, and without any rejection problem, because it is his own blood, umbilical blood clot. And not only that, umbilical blood is safer for the other patients also. That is why it is a lot of stem cells, and a very valuable tool is umbilical blood. Then the biopreservation. This review, this is 2011. This is the very latest review, the latest important information. The information which I can just explain to you, because my specialization is in this particular technology, so drug delivery technology. So what happened is, red blood cells, when they are taken, I have told you 43 days, the blood could be kept in the blood bank. But what happens is that red blood cells, they may not function to that effectively as if would have been transfused earlier. So at 40 days, suppose if the blood bank, the blood is collected. After the collection of the blood, the red blood cells efficacy or efficient, how much efficient? It should be 100% theoretically, but it's 70%. So these red blood cell 70% efficacy could be improved to 100% with this kind of a technology. The technology is about the liposomes. It's a lipid vesicles. In short, it's like a chakli. In Diwali, we know the chakli. So whatever the rounds are there, in between the rounds, these red cells go and they lodge there, and they are not getting affected by the environment in the refrigerator, and they can survive for a longer time. Storage lesions, use of liposome as a permeabilization strategy for the intracellular accumulation of novel intracellular cryoprotectant. So whatever cryoprotectant, that means the protectant, those chemicals which are there in the along with the blood, they remain and protect the cells in a capsule-like thing, and that is called as liposome or lipid vesicles around. And the inside that there will be red blood cells, and red blood cells will be surrounded with the cryoprotectant, and the protection is better. So that they are coming. So these are the two things which can definitely come up as a future. Another thing is, women will start donating the blood after the public awareness about it, the fact that there should be some kind of a donations from the women also. So, and our need, as you know, 40 lakhs of units. One unit is 450 ml. So in India, the requirement is 4 crores of blood. Thank you. One second. The book was there.